great option for women, but what about men? Well, bremelanotide has been studied in a subset of men for the purposes of low libido and erectile dysfunction. The number of patients that have been looked at have ranged anywhere from 19 patients to up to 342 patients. And in these small studies, these men took bremelanotide either as a nasal spray or as an injection. And what they found was that bremelanotide did increase low desire. It also increased the rigidity of the erection, the duration of the erection, and overall satisfaction with sexual intercourse. The side effects most commonly were nausea and flushing. In the largest study, 342 married men were recruited who had taken sildenafil but didn't respond. And they were given either 10 milligrams of bremelanotide as a nasal spray, or they were given a placebo. And they were told to use it 45 minutes to 2 hours before intercourse, and they had to try it for at least 16 uses over the course of the study period. They described a positive clinical response as ability to maintain an erection and satisfaction with intercourse. And they saw a positive response in 33% of men who took the medication versus 8% of men who took the placebo. And so this sounds great. Do we have a new option for erectile dysfunction or even low desire for men? Not yet. So this is still in clinical studies for men. It has not gone through the rigorous trials it needs to go through to become FDA approved as a medication for low desire or erectile dysfunction for men. However, it is given off-label. From what I understand anecdotally is taking this medication gives you a very strong desire for intercourse, which can be very uncomfortable if intercourse is not on the table. Also, it is associated with some nausea, and usually after using the medication, you can feel as if you've got a cold or some significant fatigue after it wears off. Generally speaking, if you've got really bad high blood pressure or really bad heart disease, I don't recommend trying this. And if you really want to try this, I suggest you see a urologist or other healthcare provider who is expert in sexual medicine so that you can be overseen and make sure that you're doing well on this medication, you're not having any adverse effects, and that if you do have a problem, that someone else there to help take care of you.